Here at Lunt Chiropractic, we often see various conditions frequently that have a lot to do with activities of daily living, meaning what you're doing on a daily basis, one of which would be considered something called lower cross syndrome. If you're a person that does a lot of sitting for work, if you are lifting repetitively, if you're not getting the right stretches in at the end of a long day, you could be developing some chronic lower back pain along with potentially some sciatic issues and really tight hips and pelvic muscles. So you can see in Madison here as she's sitting, she's at a 90-degree angle and her hips are bent. Your hip flexors are muscles that attach from the front of the hip in deep through the abdomen to the lower back. So anytime that you are bent forward or that your hip is flexed, it's going to create a tightening in that muscle, which will then pull into the lower back because that's where the muscle is attaching to. When you're sitting for an extended period of time, the hip extensors become very contracted and irritated, which will then cause a lot of inflammation in that area and can result in sciatic symptoms. So one of the treatment methods that we concentrate on here in the office is addressing tight hip flexors in order to add more extension in through the pelvis to create a little bit more of a posterior pelvic tilt as opposed to anterior, and kind of getting into the hip extensors in order to loosen up some of those tight muscles and alleviate some of the inflammation that would result in sciatic symptoms. We're going to have Madison lie face down, and I'm going to go through a typical chiropractic treatment for somebody that would be suffering from something called lower cross syndrome. So you can go ahead and lay on your stomach. The first thing that we would do would be concentrating on the pelvis and the hip area, especially if somebody was experiencing sciatic symptoms. There's a lot of inflammation that can result from long period sitting, especially at a desk or a computer, that will put pressure in through the sciatic nerve, which comes out right in the middle of the hip area here. So we like to do something called a pin and stretch of your muscles, meaning that I'm gonna be kind of holding down on some of the musculature while we're kind of moving her around through her range of motion in order to loosen up some of the surrounding tissues to alleviate some of that inflammation and pain. So we would get into the muscles, we would do a lot of loosening in order to loosen up the glutes, the piriformis, and then therefore again alleviate some of the pressure into the sciatic nerve area. After we do some of the hip loosening, we would transition into some flexion distraction for lower back discomfort, which is a spinal decompression technique. So the flexion distraction flexes at the waist in order to open up all of the discs in the lower back, which will then alleviate some of the pressure on the nerve roots. It will stretch the muscles at the same time, and it's generally a really wonderful sensation for patients because it feels like a really nice deep stretch right into the lower back that people can't often reproduce on their own.